foods and environmental triggers such as caffeine, chocolate, spicy foods, high-calorie diets, acidic foods. All of these things need to be taken into account. And then pacing feeds, so eating slowly, making sure to chew your food well, smoking, certainly eliminating smoking or exposure to smoke can help with improving reflux. Things that will be helpful are exercise, chewing gum or lozenges. So the act of constantly having saliva, allowing the liquid contents to push anything down from the esophagus. And also the chewing motions helping with the motility of the food pipe going into the stomach. And then certainly over the last few years, there's been more research on deep breathing exercises and how it impacts the area of around the diaphragm and the muscles around the lower esophageal sphincter. So I recall yesterday I had showed this image where you have the upper esophageal sphincter at the top bit, where you have high pressure zones and it's quite tight, and the lower esophageal sphincter, which is in green, it opens up to low pressure, which is blue. And with meal times, and then when you do diaphragmatic breathing, you can get the muscles to tighten up and you can see this slightly higher pressure zone. And so there was a research study that showed in individuals that have a higher amount of transient lower esophageal reflux when they did diaphragmatic breathing for 15 to 20 minutes. I believe it was 20 or 30 minutes after mealtime, that had reduced their overall numbers of reflux. Common medications that we use, so antacids such as Tums, which is calcium carbonate, so that will neutralize the acidity and help with symptoms of acid reflux. There's medicines such as Gaviscon, particularly found in Europe and the rest of the world, which is sodium alginate. What that does, it creates this film over the top of the fluid and food contents in the stomach, and therefore, that gel-like mixture helps to prevent reflux from coming back up into the food pipe. Sucralfate or carafate, that binds to areas of irritation in the stomach, and by doing that may decrease the irritation that may then propulse some food contents back up. H2 blockers are things like famotidine or Pepcid. So this is one form of acid suppression medication, and PPIs such as omeprazole are another one. Omeprazole and the PPIs are more potent than the medicines such as famotidine. But overall, what they do is they decrease the stomach from producing acid and to go into the stomach, and therefore reducing the amount of acid reflux that may come into the esophagus. We will utilize medicines that help with the motility of the food pipe or stomach, and particular ones such as Bethanicol, which helps more with the motility of the food pipe. The metronite, other medicines such as Reglan and erythromycin help with pumping food out of the stomach. Baclofen is a very useful medicine where it helps to tighten the area between the lower esophageal sphincter and the stomach, but it has other properties to relax skeletal muscle, and is used in a lot more patients that have spasticity. So those that may have cerebral palsy, for example. It has been used in adults, but it's otherwise not used as much in pediatrics due to some of those concerns of side effects. And after medications are not effective, there are a couple procedures. One is called the Lynx procedure. So this is where surgically or potentially endoscopically magnetic beads are placed around the area of the lower esophageal sphincter, with the idea that when food comes down, it's still able to come through because it generates enough pressure to push past. But then the magnets help to compress the tissue around the food pipe, hopefully helping to decrease the amount of food contents and liquid coming back up from the stomach. And then a Nissen fundoplication is a more permanent solution where the surgery team would utilize the tissue at the top of the stomach to wrap around the junction between the food pipe and stomach. And that wrap will then prevent food and liquid contents from coming back up. The ideal wrap is still enough for liquid down while preventing significant amounts coming back up, unless you get to the point of having more forceful vomiting, in which case liquid can still come up. So we looked at other studies that looked at maybe complementary medicines and herbal medicines. In general, from a reflux standpoint, there's certainly other ones that have been utilized, but maybe haven't been studied so well. In Chinese medicine, this first one has more commonly been used and has been studied compared to PPIs such as omeprazole, and is found to be relatively effective in what we call non-erosive esophagitis. And so what that means is when you have reflux, you can have both acid reflux and you can have just liquid reflux come up. The acid reflux is what is likely to cause damage and irritation to your food pipe, and that's called erosive esophagitis. But if you have liquid and food contents coming back up, but doesn't actually cause damage to the food pipe, that would be non-erosive esophagitis. Um, and the some of these other medicines can be utilized because it's not necessarily targeting the acid component itself. Melatonin has a big role within the GI tract and definitely in the stomach. And so it has been found to increase the lower esophageal sphincter pressure. And that actually, as a function, is better than what the PPI would do relative to just the pressure itself, though it's not better than the PPIs in terms of decreasing acidity and helping with issues such as erosive esophagitis. Common side effects that may be seen with medical therapy. So, with the antacids, and depending on which type you use, there is magnesium, aluminium, and calcium based. It can have different levels of absorption, and in particular, those that have renal disease, there can be more of an effect. The acid suppressions, such as PPIs and famotidine, have been implicated in issues such as C. difficile infection, community-acquired pneumonias, and malabsorption of multiple nutrients, including B12, iron, magnesium, and therefore increasing risk of osteopenia and osteoporosis. These side effects, in particular, have been seen in older populations and typically over several years of consuming these medicines. And so there's a slightly higher risk, though certainly in terms of risk benefits, there's a risk of increased acidity causing damage to the food pipe and risk for other cancers. Those risks would certainly outweigh the potential side effects of the medication. So it all depends on the individuals. Baclofen, as I said, definitely helpful for tightening the area of the lower esophageal sphincter. It can result in drowsiness, and in some individuals lower the seizure threshold. Um, Reglan, or metoclopramide, has a black box warning for a dystonic reaction. What that is it's kind of like a stiffening episode of all of the muscles. It's not a seizure, so patients are still very much with it, but they feel the muscles all cramping up. There is a one form of it that is irreversible and so has a significant issue, though it's typically a rare side effect, especially at the lower doses that are used from a gastric emptying standpoint. So gastritis, so recall this is where you have inflammation in the stomach. The multiple causes, including smoking, um, uh, NSAIDs such as ibuprofen, or issues such as H. pylori bacteria. So initial treatments are certainly understanding what those triggers may be and trying to remove those triggers. For H. pylori bacteria, in particular, when associated with gastric ulcers or significant irritation, the treatment is typically high dose acid suppression with something like omeprazole and Nexium twice daily for at least 2 months, and two antibiotics for 14 days. When you have significant gastritis and issues with erosive esophagitis, you typically need to be on PPI treatment for at least 2 to 3 months for adequate healing. Medicines such as Carafate, which provides more of that topical band-aid when you have ulcers, is typically a short-term use, and typically within that first week. Moving on to constipation. So the causes of constipation being often related to lack of fiber, fluid, activity, potentially anatomical issues, and impaired function to be able to relax and empty out. And so correcting it would mean to have appropriate fiber intake. So um, in most individuals, essentially getting more than 25 to 30 grams of fiber a day is going to be helpful. Fluid intake, we discussed having closer to 64 ounces at least would be ideal, though certainly with appropriate fruit intake, that would be decreased slightly. Physical activity. So previous studies have found that walking for at least 30 minutes daily decreases risks from a constipation standpoint. The fruits that we commonly discuss to help with stalling are prunes, pears, apples, kiwis, cherries also have a reasonable role as well. Looking at other East Asian treatments. This Japanese mixture includes a Japanese pepper, ginger, ginseng, and maltose, and has been studied to be effective from a stalling standpoint. And then ashwagandha and okra have been studied as uh, powders that can help with constipation as well. So medications that we commonly use. So polyethylene glycol, the brand's typically Miralax, magnesium oxide or hydroxide, and lactulose are common laxatives. The way that they work is essentially to prevent the colon from reabsorbing fluid to go back into the system. And so it keeps the fluid within the stool to keep it soft and mushy. The more you use of these laxatives, the looser the stool gets. And if you don't use enough, then it doesn't become soft enough. lactulose is a synthetic sugar that we don't digest, but the bacteria in our GI tract does, and it creates a acidic molecule. But in that, it has a byproduct of gas. So some individuals that take lactulose will become a bit more gassy, though all of three of those can certainly cause some amount of cramping. The stimulant laxatives are senna, bisacodyl, and picosulfate. Senna is a milder laxative. It's a plant-based alkaloid. For most of these medicines, essentially, they go down to the colon, and there's some metabolism with the bacteria in the colon. Um, but they cause a variation of irritants and stimulates the colon to contract. So it actually cause significant squeezing motions throughout the colon. And assuming the colon's functioning well, that stimulation propagates the stool down from from the right side all the way to the left side and down to the rectum. Um, the other class of medicines, so secretagogues. So there's a few of them that are out in the market. So lubiprostone, linaclotide are the more common ones, and they essentially cause the receptors in our GI tract to pump fluid into the bowel. And so they work somewhat similarly to the osmotic laxatives, where it's essentially getting enough of the stool to have fluid in it, so it's easier to stool, but just a slightly different mechanism. And then prucalopride or motegrity is uh, it's a motility on specific receptors to help with moving with getting the intestine to have these wave-like motions to move downwards. And this can work through the small intestine as well as the colon. And then moving on to the disorders of the brain-gut axis. So recall I discussed there's a few different types under this umbrella. Irritable bowel syndrome, functional abdominal pain, dyspepsia. There's a few medicines that have overlap for all of them. So common ones include TCAs such as amitriptyline. The way this works is essentially to affect the nerve system within the GI tract to dull some of the pain. It doesn't work like an opioid, but there is essentially pain receptor function that helps with the bowels and other parts of the GI tract that may uh, show pain signals. Um, when we talked about disorders of brain gut axis, there's multiple things that go into it. Some of it is whether there's been previous exposure through viruses, foods that maybe triggers, environmental triggers, but also stress and anxiety, and workloads and the flight or fight response that may be stimulated from the sympathetic response. So some of what is used to help modulate that from a therapy standpoint is also things like SSRIs. So this is something like Lexapro, for example, by affecting the mood and mental state, and therefore helping with potentially anxiety and depression that may be triggering some of the pain response in the GI tract. Antispasmodics, so this would be something like Levsin or hyoscyamin, and similar to peppermint oil, actually, essentially functions to relax the smooth muscles of the intestine. When you're having IBS, there's going to be dysregulation of the bowel. There's going to be a lot of cramping episodes, likely because the muscle tone in some areas may be tight, but also because the gas that may be trapped in the bowel is causing a stretch feeling in the intestines, and so sending pain signals. So these medicines help to relax the bowels and therefore decrease that pain response. Peppermint oil has certainly been well studied and is very effective from that standpoint. Um, Probiotics, and so there was a question yesterday if probiotics have been helpful, and it's been looked at in these types of diseases, and the data is certainly very mixed, but overall, there seems to be a fairly limited role, though the thought is there's not too much harm, especially in otherwise healthy individuals, maybe with the possibility of a small benefit. So when you have irritable bowel syndrome, um, excuse me, there can be diarrhea and constipation predominant, and then a mixed type. So um, for the irritable bowel syndrome with the diarrhea type, there's a few treatments. Rifaximin is an antibiotic, and it helps to decrease the bacterial load, especially in the GI tract, as it's focal to the GI tract and isn't absorbed. Um, and the thought process being that by decreasing the bacterial load, you may have decreased inflammatory molecules in the GI tract. Also, the metabolism of some of the components of our GI tract may be different, such as the bile acids, and so yeah, lowering the overall load seems to be helpful. There's there's a couple of medicines that work on the opioid receptors of the GI tract. Eloxydoline is a newer one over the last few years that has some effect. Loperamide is a more long-standing one. Many that may have either traveled abroad to India, for example, and have travels diarrhea. Some may utilize Imodium. And this essentially functions to slow down the intestine by working on those opioid receptors. And then allocetrone is a serotonin antagonist, and this reduces some of the sensitivity and also the a little bit from the motility tract as well. From the constipation standpoint, so similar to the meds that I discussed previously with the constipation, so the secretagogues like linaclotide, this has an effect both in helping with stooling by secreting fluids, but it actually works through a specific pathway. It's called a cyclic GMP pathway, and that actually helps to modulate pain to some degree as well. So that has somewhat of a dual response. The more newer ones, tenapanor. So this works in the sodium proton pump inhibitor. And so by doing that, it prevents the absorption of sodium into the bloodstream, and water and fluid will follow the electrolytes. So by creating that higher electrolyte amount in the intestine, the water will follow that and then allow the stools to stay loose as well. This has been studied in this specific population, IBS-C, and it's been found to be effective. And then, like I talked about, the mixed type, where you may have alternating constipation, diarrhea, but really with that pain response, the combination of these medicines can be helpful. So outside of the medications, so certainly multiple areas of therapies have been looked at. The thought process of cognitive behavioral therapy alongside medication treatment, at least for the first year, actually has the best success rates. And so the idea of cognitive behavioral therapy is working with therapists to talk through the negative thoughts and emotions and trying to change perception for both pain responses and things that may be going on in the individual's life. And so this is again where that interaction between the brain and the gut has a significant impact. And this type of therapy has been found to be very helpful. There's also hypnotherapy and mindfulness therapies to help. Hypnotherapy is in particular when you have somebody that can help with guided imagery, helping you to navigate pain responses and discomfort that you may have, and potentially underlying issues that may have resulted in some of these GI manifestations. Um, and as you all know, with doing yoga meditation, as we are with these courses, certainly the deep breathing, relaxation, mindful techniques have certainly had a role and found some utility. Many of the studies have been found more so in Eastern medicine. Um, the randomized trials haven't found as much use in Western therapies, but likely there's been a lot of different types of yoga, meditation, and mindfulness therapies. Um, and then moving on finally to a couple of the autoimmune diseases. So for celiac disease, this is very much based on the exposure to gluten. And so the mainstay of therapy is to avoid all gluten-containing foods, including trace amounts. There's a few different therapies that have been trialed, including injections, oral medications that help to break down gluten. For the most part, there's still many that are ongoing in trials, but haven't been successful enough for people to necessarily reintroduce gluten. But the thoughts are if people are out at restaurants and they don't know about cross contamination, they may be able to use some of these medicines to mitigate some of the response. Inflammatory bowel disease has many medications. The most common one you may see adverts for something like Humira, Remicade. So these are TNF alpha inhibitors. So these are potent immune biologics that basically decrease the immune response and therefore prevent it from attacking the individual's own body. Similarly, there are other ones such as the IL-12/23. So adverts such as Skyrizi, that's what this is. Anti-integrin, there's vedolizumab. Rinvoq is a classic one for the JAK inhibitors. And now there are some other ones that are coming out as well. But essentially, all of these medicines target different roles in the immune pathway to prevent the overactive immune system from causing further intestinal damage um, and trying to get the patients to get back to kind of a normal life, though in these cases, they end up having to take medications as a lifelong state. With inflammatory bowel disease, there is diet therapy does have a role, and in particular, there's something called exclusive enteral nutrition, where just drinking exclusively shakes such as Ensure or Cave Farms can allow for the body to heal. Um, there's newer therapies where they're trying to utilize very restricted diets to be able to do something similar. The biggest hurdles have been certainly compliance. But even when doing diet therapy, it's been effective maybe between 50 to 70% of the time. So there is certainly a component that is um, some other environmental trigger, along with diet triggers that result in overactivation of the immune system. All right.
For on the treatment of GI problems. If somebody has any questions with Dr. Vijay, please, you can ask anything.
Somebody was asking yesterday about when you have prolonged fast and what happens to the GI tract, and I went over the information again just so I knew, but yeah, so certainly when you're doing something like Mascaman, where it's long-term fast and typically after 7 to 10 days, um, it does take certainly several days for your GI tract to kind of come back to normal. Now, when you've been fasting, because you won't have been secreting as much of the fluids and enzymes. There will be some that may have been stored, both in your pancreas and your gallbladder, but that to get the production to ramp back up will certainly take several days to happen. And the other thing that we had mentioned is the intestinal villi, which are these things like projections that hold some of your digestive enzymes as well. When you haven't used it for several days, that will become slightly more flattened as well. And so that can also take several days, sometimes longer, to kind of fully form and be able to have its function well. And so some individuals during that time frame may end up having a bit more diarrhea because they're not able to fully absorb all their nutrition.
So in that case, Dr. Vijay, usually the diet contains readily absorbable nutrients like sugarcane juice or glucose containing substances. So that makes sense then.
Yeah, absolutely. Yeah. So I think the way the diets have been made to help with breaking fast have actually been certainly completely on point. Your ability to absorb glucose. So you need a couple transporters as well. So you need some electrolytes and so sodium chloride, for example. And so having initially a combination of the fluids with that will be very important. So it's actually harder to drink water alone and absorb water alone. You need the electrolytes and sugar for it to actually pass the cell into the villi and into the bloodstream. And you need a gradient to allow the water to actually come with it to help get you rehydrated. And that's the premise of oral rehydration solution. And so essentially, when you're breaking a fast, long-term fast, you're essentially utilizing that type of diet to help with it until you've regained enough energy stores and you're able to re-synthesize some of the proteins and fluids that your body makes.
Mhm.
though there are exceptional cases, but hardly one monk he can continue fasting for 6 months. So how far these storage work?
Sorry, somebody repeat that question again.
Okay, see, one monk he is doing 6 month fasting. It means fasting for 6 months continuously, and he is still very healthy. He has no problem. So just I'm telling that you said that there are certain vitamins or proteins they are stored in gallbladder and pancreas, and we consume that during fasting. But what happens those people who do fasting for 1 month, more than 1 month, or 6 months even?
Yeah, I mean, I've seen a couple of studies that really look at the equivalent of mass common. I haven't seen anything that looks beyond that, but I would expect it to be fairly similar because really after the first 5 to 7 days of fasting, the body mechanics and metabolism seems to be pretty similar in that um, what you're utilizing from a body standpoint is what we call ketones. So it's a breakdown of fats from an energy standpoint. Your muscle and core muscle is actually maintained as much as possible, um, with the general premise that if you're coming out of starvation, you still need your muscle and activities to be able to move you around from one place to another to be able to start consuming food. So there's a core muscle amount that is still preserved until late on. But yeah, in terms of the enzymes and fluids, like I said, I would expect there's some amount that may still have been either stored or in an inactive form in the pancreas. And similar with the bile, where your gallbladders may have some amount in it, um, but it wouldn't be at a state of constantly replenishing and reproducing until you start your digestive process, get the motility going, and then yeah, and then rebuild all of those stores.
It is for my curiosity. What happens to the animals and birds? They are eating hardly one type of thing or grass or plants, but their body is more powerful, having more strength. The horse is eating only the chana, or the elephant is eating grass or leaves, but they are getting all the elements and they have enormous power then in comparison to the human beings who are taking so much nutritions and proteins and etc.
Yeah, that's certainly fair. I think it's probably hard to say like across all species, but there's likely to be differences both in so for example, like with birds, the nutrition that they'll take, the microbiome that will be there, the genetics will allow them to be smaller, but still create enough fat stores to be able to then use that energy for flight. But their anatomy also means that they can be lighter, right? So they are predominantly full of air to be able to move and go through the air. Horses, on the other hand, or mammals like elephants, right? So if they're having a lot of grass, they're probably also taking in a lot of mud or other things from the ground. And so they end up taking a lot of the micronutrients that way, but they also have a different microbiome in the GI tract. And cows, for example, we know for example, where they have a very important symbiotic relationship where the bacteria that are in their GI tract help to produce a lot of these essential nutrients, such as B12, and so that's how they're able to kind of sustain themselves better. It's very likely when we go through periods of fasting, we're actually a lot of the times recycling some of the same cells and utilizing it, versus if you're constantly eating, your body may not need to necessarily recycle to the same degree because you're already replenishing it. So there is likely some differences from that standpoint as well.
So Vijay, a quick question. So usually in a normal conditions, how many days that the body will become a normal after the fasting?
So there's been a few studies that looked at how long did it take to get back to uh, normal energy levels and then regain muscle mass, especially in long-term fasting. So like I said, in terms of producing enzymes and kind of just basic bodily functions, typically after several days to maybe a week or two. In terms of if you've done long-term fasting, such as mass common, for example, or even when you're doing atais and beyond, it can take anywhere from a few weeks to several weeks to regain your muscle stores and your full weight. Your initial replenishment, really, you get really more just fluid and maybe some fat, but regaining your full muscle stores can take a longer period of time. But most studies did show that those that did prolonged fasting and then broke and then were tracked even 6 months to a year out do typically regain the muscle mass that may have been lost during that prolonged fast.
Okay, and another question for those the long fasting, like a Thai or something, and if they have a acid reflux, then just the water will help, or they need to go back, break the fast, and go back to this the food cycle again.
Yeah, I mean, I think the motility component of that would be difficult. I would imagine um, uh, certainly trying to do little bits of warm water may help, and doing small sips regularly as opposed to drinking large amounts at a time. But yeah, this is certainly somewhere where that deep breathing exercises to help strengthen the diaphragmatic muscles and the muscle between the food pipe and stomach would be helpful.
And how to adjust those the gastric problem, that sometimes if you keep a fast for a day or something, and you will feel that you have a gas in your stomach or something. So how to deal with it?
Yeah, I mean, I think it's going to be similarly where you're again just trying to either be upright. You're going to do small amounts of fluids that you can kind of take, and then yeah, really just trying to do deep breathing exercises. I don't know. I haven't seen anything else that may necessarily help from a lifestyle modifications. Now, um, maybe prior to getting into fasting, you may kind of look at is your body kind of optimized in that sense? Like, have you already been doing deep breathing exercises? Are your muscles already strong from that standpoint? To be more preventative as opposed to reacting in the moment.
So breath will help to strengthen the gains of the muscles, right? So whenever you say that deep breathing, definitely.
Yeah, so the deep breathing exercises for sure, where you're taking a deep breath, you're holding that for a period of time and breathing out, and then feeling the contractions between your food pipe and stomach certainly does show to have benefit. Um, and similar kind of breathing movements or techniques that I utilize for things like singers and opera singers, for example. That has definitely been shown to help kind of tighten some of those muscles.
Thank you.
Anybody else? Thank you, Dr. Vijay, for your wonderful talk for the last 2 days. So you have spoken very well about the digestive problem and acid reflux or other problems of the stomach. And you have also shown that some yoga and meditation, how they can also help to come out of this problem, along with the allopathic medicines and other things. So thank you very much for coming.
Thank you, Amy. Cuando menos a mí.
Thank you.
Thank you, Vijay.
Okay, so now it is the time for, should we repeat the same abdomen exercise? Breathing and abdomen exercise?
Yes, Samiji.
Okay.
Yes,
now,
so because
yeah, we can repeat so that we can
so you can remember it.
learn. Yeah, you can remember, and also you can be very clear. If you have so many questions, you can ask. So now the first exercise which we will do to correct our breathing as well as to treat our stomach problems. So for that, we have to stand up in the straight with the straight backbone and neck and head. Keep both the hands hanging near the thigh. Keep both the feet together. Keeping your eyes straight to straight to the wall and take 10 breaths, long and deep breaths. Using the abdominal muscle, lungs, and collarbones. The abdomen should expand while breathing in and contract while breathing out. Yes. Okay. After completing 10 normal breathings, now you have to speedite the inhale and exhale with some speed for 10 times. Keep the eyes straight, the head straight. Now the third exercise, bend your head upward to look at the sky and quickly inhale and exhale for 10 times without blinking your eyes. Done. The fourth exercise, keep your head straight and fix your eyes 5 feet away from the ground, on the ground. And inhale and exhale 10 times quickly. Looking at the ground, you have to take 10 breaths with some fast speed. Now, the fifth exercise, it is not for persons having heart trouble. First, you have to breathe out and shape your lips like the beak of the crow. And breathe in. Inflate your abdomen, lungs, and cheeks. Close your eyes. Touch your throat with the chin. Hold your breath in with mool band. Stay in this condition for a few seconds. Then raise up your head and breathe out through the nostrils. Repeat the same exercise. Breathe out and shape your lips like the beak of a crow, and breathe in. Inflate your abdomen, lungs, and cheeks. Close your eyes. Touch your throat with the chin. Hold your breath in with mool band. Then raise up your head and breathe out through the nostrils. This exercise increases the heat of the body. This exercise is not practiced, especially in summertime. So this exercise can be repeated for 3 to 5 times. Okay. The next exercise, the seventh one, bend your body. Sorry, the sixth one, fix your palms on the waist with the thumbs in front and finger to the back. Look in front of you and bend your body at 30 degrees at your waist. Now inhale and exhale 10 times. While bending down, one must exhale in all exercise. Move your stomach with inhalation and exhalation. Okay. Now you can do the same exercise with fast speed. Bend your body at 30 degrees and inhale and exhale quickly. 10 times. Correct. Yes. Good. Yes. Try to turn your abdominal muscles from right to left, left to right, like this. Relax. The next exercise is bend your body at 90 degree. Yes. And inhale and exhale quickly 10 times. Keeping your eyes straight towards the wall. Keep your head straight towards wall. And yes. Thank you very much. Yes. Good. Relax. Now the 8th exercise. Though in 90 degree, first we do the normal breathing so that you can do. I have said for quick breathing, but you can do with normal breathing too. So you can bend your body at 90 degree and inhale and exhale for 10 times, keeping your eyes straight towards the wall. Now relax. Relax. Now bend your body at 30 degree and exhale. Hold the air out while moving the abdomen backward and inward in quick succession. Yes, you should not breathe in, just breathe out. After breathing out, you have to move the abdomen 14 times. Now inhale while raising your body. Relax. Bend your body at 90 degree and hold the breath out. Move your abdomen forward and inward quickly several times, at least for 10 times. Yes. Thank you, thank you, thank you, thank you. Thank you. Relax. While inhale, while you can raise up your body. The last exercise, keep the feet at a distance of 1 foot, 6 inches, and bend the knees as if sitting on a chair. Reset the palms, rest the palms on the knees and breathing out. Practice Uddiyaan Bandh by pressing the abdomen inside. Try to take it inside as much as possible to touch the backbone. Yes. Yes. Thank you. Yes. Relax. Relax your muscles of the abdomen and your body for 1 minute. Again, you can repeat the same exercise. Sit in the position of the chair, breathing out. Take your stomach inside as much as possible to touch the backbone. And try to move the muscle of the abdomen from left to right, right to left. Try to move it. Thank you. Thank you very much. So now all are tired. Relax. You can sit down or yes. So the stomach muscle is panning.
That was good, Samniji.
Yes.
No, it's pretty good, Samiji. It doesn't hurt. It's just the left to right is difficult. You got to
Yeah,
practice.
left to right is difficult.
Yes. It is very good exercise and we have to do every day, as I have said yesterday also. And we are instructed that if you cannot do any other exercise, you have to do at least this 10 exercise.
Wow.
10 exercise of backbone and 10 exercise of this abdomen. So we have been practicing these exercise for years.
Wow. The first part was the backbone or backbone separate? The first part was the backbone.
The backbone exercise are different. They are 10. So I will give it on Saturday. If we will be here. So it would be better for you to follow the proper instructions.
Okay.
But it is a very good exercise, abdomen exercise.
Wonderful.
Yes. So might be you all have gone through this exercise, which is given in the exercise yogic exercise textbook. So please see, have a look into that. So thank you very much. I think if meditation, if you like, I can give meditation for 10 to 15 minutes, or we can stop here.
I'm good for meditation, Samiji. If everybody's good,
Yeah.
Okay, so sit in comfortable posture. So since breathing plays a very crucial role in our health, good health, so we will focus on breathing in this particular meditation. So sit in a comfortable posture with a straight backbone, neck and head. Keep both the hands in the posture of knowledge on the knees, facing upward sky. Close your eyes softly. With 5 Om sounds, we would start our meditation. Om.
Oh.
Om. Om. Relax. Relax your entire mind, body, and vocal cord. Make a resolution. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. The first step of Praksha meditation is Kayotsarg, relaxation with full awareness. Relax your entire body, starting from the toe of the right foot up to the head. See each and every organ. Give suggestion to be relaxed. Relax. Relax. Experience complete relaxation throughout the body. Each and every neurons, cells, tissues, bones, nerves, muscles are getting completely relaxed. To have good health, it is necessary to be free of all stress. Relaxation is the best technique for becoming completely free from any kind of stress, tension. The second step of meditation is perception of breathing. Concentrate your mind on the tip of the nose. See each and every breath. Each and every inhalation and exhalation. Make your breath a little bit longer and deep. Take long and deep breath. Using diaphragm, lungs, ribs, and collarbones. Take a long and deep breath. The abdomen is expanding while inhalation, and it is contracting while exhalation. Keep your attention at the navel. And experience the expansion of the stomach while inhaling and contraction while exhaling. Take long and deep breath. Experience the expanding abdominal muscles. Use the full capacity of your lungs. With two Om sounds, we will conclude our meditation. Take long and deep breath, making the Om sound.
Oh,
Om.
oh,
Both the hands and keep them on the eyes. Open your eyes gently.
Very nice.
Mhm.
Yes.
Long or deep breathing से भी abdominal muscles और ये सारे organs properly use होते हैं, so they get massage, exercise, and also proper amount of oxygen for their function. So thank you very much.
Thank you.
Vandamina Musami.
Nami.
Very nice, very nice.
Thank you.
Yes, the
Very well.
18th week has started. Okay.
Almost
Time
complete.
is, yeah, it's now rapidly down. That's good.
Yes, the reverse counting is started. So
Lots of
hardly,
revision time. Lots of revision time. So we'll be
yes, so we have 4 weeks more for our discussion, and after there is exam preparation and final exam.
Right.
So start looking at all these therapeutic exercise, and also all other different informations which have been shared by all the doctors, Dr. Devendra and all other. So you must have the proper study of the problem so that you can deal with the patients or participants. Okay, thank you very much.
Nice meeting you.